Hi guys, it's Amy. We're going to talk about chloride now. Excuse me. Chloride, this is maybe a little smaller section, keeping in mind that chloride most often attaches to another substance to form compounds. And we know that chloride has an affinity to sodium, and that makes our salt. And so when it binds to sodium, it aids in fluid balance. Now, it also can bind to potassium to form potassium chloride, and which helps to allow both to move in and out of the cell. It needs a lot of help from other electrolytes to move in and out of cells and to perform its functions. The normal chloride is 96 to 106. I don't know if this helps. I kind of remember that, oops, I did not want to do that. I kind of remember that this looks like 10 here, this LO 10, and there's 10 between, and it's close to 100. So I don't know. 96 to 106 though. It also forms with sodium to form cerebral spinal fluid. And we know that in our stomach, especially when we vomit and we get the acid content of the stomach, hydrochloric acid in the stomach obviously is made of chloride. So hydrogen and chloride compound together to form that. It also assists in carbon dioxide transport into the red blood cells, and it helps to maintain acid-base balance. Calcium levels are closely associated with, I said calcium, I meant chloride, and sodium are closely related to one another because when changes in one directly affects changes in other. We've talked all along about inverse relationships where when one goes up, another goes down. That's not the case for chloride and sodium. They have a parallel relationship. If sodium increases, so does chloride. And when sodium decreases, so does chloride, because they're oftentimes bound together, and so that would make sense. We know that chloride is absorbed through the GI tract, and so GI disorders have a direct relationship on the chloride level. What are some of those things? Crohn's disease, celiac disease, anything that would cause malabsorption. Chloride-rich foods are those processed foods. Well, didn't we say sodium? High sodium foods were processed foods, meats, canned veggies, salty foods, that kind of thing. But chloride also can be found in fruits and vegetables. Okay. All right, the hypochloremia is low chloride level, and that's less than 96 milliequivalents per liter. We see that chloride, if you think about how sodium was excreted, it was mainly excreted through the urine, but it was also excreted through the sweat of the skin and also through feces. So let's look at this. Oh yeah, they're the same thing. Low sodium and potassium levels can affect the chloride level because potassium also, as I said, binds to chloride, and that's what allows both to move inside, or it allows the chloride to move in and out of the cell. And you can see, if you think about how you've heard different substances in the body, potassium chloride, calcium chloride, hydrochloric acid, sodium chloride, so it binds to other things. If we see that there's a fluid overload, such as CHF, it can cause that dilution effect, the change in concentration based on the dilution factor. And then things that cause an acid-base imbalance, such as DKA and Addison's disease. What's important here is that chloride does have an inverse relationship with bicarbonate. And if you remember, bicarbonate is alkaline. And so if chloride goes up, the bicarb goes down, we see acidosis. If the chloride goes down, we see the the bicarb go up, we see alkalosis. What have we said in several things? We see alkalosis when the chloride goes down, same as with potassium and magnesium. Here are symptoms of hypochloremia. Get smart quick. That's what we all hope to do, right? But when we see hypochloremia, we see an increase in metabolic activity, if you will. Seizures leading to coma, obviously those are later symptoms. Muscle cramps, arrhythmias, respiratory arrest, twitching tetany, and hyperactive deep tendon reflexes. All right, so obviously we're going to try to treat the underlying cause and try to get them some salty foods to correct it. Some of the medications that can cause it, I didn't have on your list, but there are basically what we've said all along. Loop diuretics, osmotic diuretics, and thiazide diuretics can cause low chloride, but it also could cause low sodium. So, if we parallel this with sodium, it helps us to understand. Hyperchloremia is a high level or greater than 106, and causes can be due to hypernatremia or an increased intake of chloride, especially if the fluid is lost from the body. So if we have maybe dehydration and we take in a lot, it increases the concentration. We see with hyperchloremia a decrease in activity, a weakness, lethargy, Kussmaul's respirations, active heart. So we're going to see an increase here, tachycardia, elevated blood pressure. So, you know, that little saying about the metabolic activity may not really work here. This might be one that you want to just memorize. That is it for chloride.